Now about the taper, I'm trying to cut the preparation of the crown into pieces so you could orient yourself and know how to understand each better alone. As I told you that the natural morphology of the teeth come in two planes. We have the lower half of the axial on the buccal surface and the upper half. The lower half is more vertical while this is more tilted. That means when I want to prepare to mimic this in the preparation later, I should have two orientations of the bear, this one and this one. Okay, if I'm preparing for the lower, I also should have these two planes. So I'm going to orient myself. One that's close to vertical and then another one that is more tilted. In this case, specifically, this is a lower tooth. So the functional bevel is on the buccal. So I have a third orientation. So I have three planes, actually. I will have the gingival, the mid half, and then the functional bevel orientation. The orientation of your bevel is correct. I could see the beginning of the bevel here, I could see the end of the bevel here, and this orientation is correct, but it's flat. I would prefer that I would have it in separate planes. Okay, this functional bevel is not apparent. I could not see a plane. Here I could see this area, see? There's an area, but here I don't see an area. Okay, look closely. I don't see an area. I see a line. Okay, so that means you need a functional bevel here. You have created this lower half orientation correctly. The upper half you oriented well, but the functional bevel is not there. Okay, distally, this is mesially. Distally, I find that the upper half also needs more beveling. Okay, not from the functional bevel, but actually the other half of the tooth. The gingival is okay, but the upper half is not well tilted. Okay, mesial is better. Now, my demo here is concentrating on how not to over taper. I've seen this in one of the YouTube videos. I don't know which one it was, but it was an excellent tip that I now, for years now, I've been using it, telling my students the same tip, which is, don't move the head of the handpiece away from the center of the tooth. I'm talking about this head, not the bear, but the head. So when I'm preparing, I'm going to go like this. I want to show you. If the head goes off the center area, that means I'm over tapering. Okay? So while I'm preparing, the head should be around the center of the tooth. If I'm moving to the proximal, the head should go once more back close to the center of the tooth. When I'm going lingual, the head goes back here. If the head is off the center of the tooth, suppose this is the direction, I want to show it in the camera. Okay, if the head is off the center of the tooth, that means I'll have undercuts. Okay. Yeah. If the head is tilted away from the center of the tooth,
I'll have taper.
I'm not looking, once more, I'm not looking at the tip, I'm not looking at the bear, I'm not looking at this side, I'm looking at the head itself. So once more, look at this orientation that I'm going with. The head is outside the tooth, sir?
Yeah.
The head is outside. This is over tapered. Okay? So to keep the taper correct, always concentrate that the head of the handpiece is over the center of the tooth, not more than that. So this is the one where I'm doing the lower half, and I tilt a bit more for the upper half, but both of them I'm still in the center of the tooth. I haven't gone away. Neither away outside, neither crossing it and going to the other side. This is over taper, this is undercuts. Okay? This will create undercuts. Thank you.